The government is deploying drones for the transportation of samples taken from persons suspected to be infected with coronavirus for onward delivery to the various centers for testing. This was disclosed by President Akufo-Addo yesterday when he addressed the nation on measures being adopted in the fight against COVID-19.
Government has also introduced the use of drones to expedite the transportation of samples to laboratory centers. On Friday, 17th April, for example, 51 samples were delivered from the Ominako Drone Distribution Center to Noguchi. Furthermore, we're introducing rapid results testing to augment our surveillance and enhance contact tracing efforts so that we can quickly isolate and treat confirmed cases. From the 68,591 samples tested, we've been able to understand better the dynamism of the virus, mapped out its geographic footprint, and established current and potential hotspots. We've also been able to isolate and educate asymptomatic carriers and thereby help minimize the spread of the virus. So far, it has been established that the virus was imported into our midst from foreign shores and is being spread through person-to-person contact. The majority of persons infected in Ghana have mild to no symptoms at all, whilst a very small number have required hospital treatment, of which 9 persons with underlying ailments have died. Towards treatment, we've expanded and added to our network of COVID-19 treatment centers, with the Ghana East and Bank of Ghana hospitals being 100% dedicated to the fight. In addition, we have set aside separate COVID-19 treatment centers at the University of Ghana Medical School, Hospital, the Kolebu Teaching Hospital, Komfo-Anokye Teaching Hospital, Kumasi South Hospital, and in other designated regional and district hospitals. Last Friday, I was honored to do the virtual sod-cutting ceremony for the construction of a 100-bed infectious disease and isolation facility at the Ghana East Municipal Hospital, which is being funded through a public-private partnership under the leadership of the Ghana COVID-19 Private Sector Fund, and whose construction, with the assistance of the 48th Engineer Regiment of the Ghana Armed Forces, will be completed in 6 weeks.
President Akufo-Addo there last night. So let's find out how this process actually works. I have on the telephone line now Daniel Mafo, his country manager for Zipline. They are carrying out this process. Hello, Mr. Mafo.
Hello, Gifty.
Good to have you. Good afternoon. Good to have you, and thank you very much for your time. Let's begin with how this works. Essentially, give us a mental picture.
All right. So how this works is we liaison with the various health facilities that are within our distribution center radius, and people are going to these centers with suspected cases, so long as they meet some of the symptomatic profile. Let me put it that way. So when they collect these samples, one thing that people don't know about the COVID-19 samples is they must get to the testing labs as quickly as possible, because you need to keep them in a cold chain system, 2 to 8 degrees. So because of the, some of the remoteness of some of the facilities and where they are, a challenge was making sure you could collect samples and then sending them to Noguchi or KCCR in time and in the right conditions that need to be there. So what happens now is we work with the health facilities because we are much closer point to them. And then we obtain the COVID-19 samples well packaged from them. And then using the drones, we are able to get it from Ominako to Noguchi in about 32 minutes. Okay. And from our center to KCCR also in about 25 minutes for them.
Let's take a look at how many test flights you've conducted so far. So far, I mean, how many have you done so far?
So we did test flights, but we are actually delivering samples now, just as the president mentioned yesterday. Over the weekend, I think we delivered in total about 56 samples, 5 going to KCCR and the remaining going to Noguchi as well. So we've gone beyond the testing of the, should I say, the use case testing phase. We are actually delivering samples now.
And how many can be sent at a go with the drone? So
it's not really limited by how many can be sent. It's the number of samples. From our distribution center, we have the ability to do up to 150 flights per day. And for instance, with about the 51 samples we delivered on Friday, that went in about 4 flights, but it was because of how they are being packaged from the health facility. Once they close it, we don't touch it. So if they give it to us, with a number of samples in a container, we'll just deliver it. That's how we do it.
Well, finally,
so if you're looking at it from that possibility, we could probably deliver more than thousands of samples.
Certainly, I mean, these are just swaps. So which areas, I mean, from the remotest parts of Ghana, are you mainly operating from as far as bringing in these samples are concerned?
So the health facilities within our catchment area is what we can deliver. As of close of the weekend, we had picked up samples from parts of Lower Menya Krobo, parts of Suhum, parts of Setre East. So it's as and when the samples come up, and then we pick them and then deliver.
Right, interesting.
But in theory, we could pick samples as far as from somewhere in the farm plains to even deliver. Yeah.
Okay, we'll certainly be keeping an eye on it. Hopefully, this helps us in our response to coronavirus. Mr. Mafo, thank you so much for your time.
Thank you too much. Thank you.
Daniel Mafo is country director for Zipline. They are responsible for using the drones to convey to the various testing centers some of the samples taken for coronavirus tests. So how different has the drone service impacted, or how different has the drone service added to our efforts in testing? Some scientists at Noguchi have been speaking to this.
Started doing diagnosis for COVID-19 here at the Institute a couple of weeks ago. With the sample volume has increased, and now we are getting samples from all over Ghana. We're very grateful that the Zipline drone service is now in operation. After a couple of test drops, we've actually received the first sample today from Suhum. We're looking forward to receiving samples from wherever Zipline can get the drone to pick up and deliver to us, because this will speed up and facilitate the sample transport and, of course, the return of the results back to the facilities where the results are needed, especially outside Accra. I think as we expand testing outside Greater Accra and Ashanti region to other sites throughout Ghana, I think the drone service will be really very necessary to facilitate the transport of the samples, and of course probably also the return of the results, paper copies, back to the originating sites as well. So we encourage Zipline to continue this excellent work, and we hope that it will enhance diagnosis and help in COVID-19 response in Ghana.
I think that Zipline may save some cost in terms of those coming from far off places like Kratchi. They would drive all the way here, get here late in the night with just one sample. But I believe that with Zipline, then you don't have to put a driver and somebody at risk. The package can easily be dropped quickly without they driving all this way with just one sample and driving all the way back. And I believe that it's an advantage, especially those who come from far off places with just a few samples. And so I think it will work very well, especially those coming from those places with very few samples. And of course, we can talk about the cold chain. The integrity of the cold chain will be kept, as it arrives as quickly as possible. I think the packaging was fine. The sample was well kept. It had an ice pack. It had, it was well cushioned and well packaged to prevent spillage. And on the whole, I think it was a good packaging.
Some scientists at the Noguchi Memorial Institute